Friends, welcome to my YouTube channel Kavita Nursing Notes. So I am making the video in Hindi as well as in English. So let's start the video. So we are dealing with CAD. So CAD is our coronary artery disease. So first we will discuss the term coronary artery. Coronary arteries are mainly in our heart. As we all know that our cells and body tissues require the blood supply, as blood contains oxygen and nutrition and other supplements which are needed for the metabolism of cells. So similarly, as of other cells in our body require blood supply, our heart also needs its own blood supply, and this blood supply is done by our coronary artery which are present in our heart. So this disease is mainly of coronary artery of our heart. So let's start with the definition. So coronary artery disease is narrowing. It means this coronary arteries get narrow or they get blocked. So why this coronary artery get blocked? As this get blocked usually caused by the buildup of fatty materials. Actually this process happens in a decades. It doesn't happen at initially. It takes a long time to happen. Okay, so there is a deposition of fatty materials get built up in our arteries, and this fatty materials called as plaque. As you know that there is an arteriosclerosis term. Okay, so I'm writing this term here, arteriosclerosis. Okay, so arteriosclerosis means hardening of our artery. So arteriosclerosis part is our atherosclerosis. So atherosclerosis is a process in which there is a deposition of fatty materials in our arteries wall which is called as plaque. Okay, so coronary artery disease is also called by other name. We can call it as a coronary heart disease, ischemic heart disease, myocardial heart disease, or heart disease. Okay, so let's discuss it once again. So we know that this disease is present in our coronary artery, and these coronary artery are mainly supplied blood to our heart. So here is right coronary artery and here is left coronary artery, which you can see in the diagram. So left coronary artery is again divided into two parts. One is circumflex artery and other one is left anterior descending coronary arteries. So the main function of this coronary artery is to supply the blood, which is oxygen rich blood, to our myocardial cells which are present in our heart. If suppose this artery get blocked due to the buildup of fatty substance, then there will be the necrosis, there will be the death of our cells, tissue of our heart which are called as myocardial cells. Okay, so if there is left anterior descending coronary artery get blocked, so there are chances of 75% chances of heart attack in our left ventricle side. And if our right coronary artery get blocked, then there are 60% chances of heart attack. So we are discussing with CAD. CAD means coronary artery which are present in our heart, which get built up with fatty materials, fat deposition, and there is a narrow of pathway. So blood will flow resistantly through our arteries wall, and there will be the depletion of blood supply to our myocardial cells and tissues, and they will die. Okay, I am going to show you with this diagram. Okay, so this is our normal artery and this is our blocked artery. We can say that we can take two pipes. Okay, this is our normal pipe and this is our blocked pipe. Okay, in this blocked pipe there is debris. So if water is flowing in this pipe smoothly, okay, there is no problem in this water, and here if the water is flowing, it faces a resistance of a debris here. So similarly in our heart, in our coronary artery, the blood is smoothly flowing from this artery, and in this artery, due to the buildup of fatty substance, due to the buildup of plaque, the blood will face a resistance and it will create a more increasing pressure in our blood supply, and the less blood will reach to our cells and tissue. and our myocardial cells and tissue will get death. There will be necrosis happen, and there are chances of heart attack. It can be mild heart attack, it can be severe heart attack. Before coming to causes and risk factor, we can discuss with the epidemiology. So there are more chances of heart attack in men over the age of 45 years, and in women it can happen after 60 years of age. And in epidemiology we can write that it is the most common cause of worldwide death of heart attack. Okay, so now let's discuss with our causes and risk factor. I have divided this into two parts, modified and non-modified. Modified means it is in our hand. Okay, we can change it through our lifestyle or our routine. We can change this factor. So let's discuss with modified. In hyperlipidemia, if there is a high cholesterol level in our blood, there are more chances of coronary heart disease. So there are two types of lipids present in our body. One is called as a HDL cholesterol, high density lipoprotein, and other one is called as low density lipoprotein. HDL is good cholesterol. If the amount of HDL will get increased in our body, it will be beneficial. Okay, and LDL is a very bad cholesterol. So if there is a chance of increase of LDL, it can cause a heart problems. Okay, so if hyperlipidemia will happen, there is an increase of blood cholesterol. How much it will get increased? More than 240 mg per dl. If the blood cholesterol is more than 240 mg per dl, it will lead to heart attack. Smoking irritates the wall of our arteries. Okay, it have a chemical or nicotine which irritates our coronary arteries and can damage it. Alcohol create a hypertension. It increase the BP, which create a forceful pressure in our blood, and which can irritate similarly our coronary arteries. Diabetes mellitus, due to the increased amount of sugar, our body cells and tissue require more oxygen demand. There is a more oxygen nutrition requirement, and it will increase our pressure of blood because our cells and tissue require more oxygen for the metabolism. In hypertension, we have discussed in alcohol, there is increased chance of BP. Physical inactivity, high stress level, overweight and obesity, which is a main factor of our heart problems. So due to the overweight, there is a much requirement of nutrition, much requirement of blood to our cells and tissue, because the body surface area of our cells get increased as our body is overweight and our surface area is increased, so need a more oxygen requirement. So through the lifestyle changes or through our good dietary habit, we can change this. In non-modified, which is not in our control, such as genetics. In genetics, it can heart diseases can travel from families to family. It is a hereditary problem. In increasing age, as we know, in man 45 years, and in women, mainly the women who are post-menopausal women, mainly which are post-menopausal after 40 years, and autoimmune disease in which our own antibody attacks our own cells. Okay, so these are our risk factors. Now let's discuss with pathophysiology of our CAD. So before discussing pathophysiology, let me tell you about our artery. This is our coronary artery, and you know our artery have three walls. Outer one is called as adventitious layer. I am not writing it. Okay, so outer one is called as adventitious layer, middle one is called as media, and the inner one, okay, so inner one is called as intimal layer. I am writing it here. Okay, intimal layer. So it is the inner layer of our artery, which is made up of endothelial cells. So if due to any cause there is a damage of endothelial layer and intimal layer, okay, intimal layer is made up of endothelial cells, so there is a damage of endothelial layer. So what will happen? There is a damage of endothelial layer, so fats and lipids and cholesterol will get accumulate here. Okay, it does not happen initially, it happens after a long period of time, means after a chronic condition, in decades it happens. So in intimal layer the lipids will get deposit here. So what will happen, our body immunity system get triggered and it will create an immune reaction in which our T lymphocytes and monocytes will infiltrate. They will attack to this area, they will infiltrate to this area, and they will ingest here lipids, means they will engulf all the lipids and cholesterol and will get die here only. And if they will get die here only, they will create a debris here only. Okay, the layer will start formation here. So with time the smooth muscle cells in the vessels will get multiply and they will form a fibrous cap which is called as plaque, this yellow part. Okay, so after a long decades this plaque will deposit here due to the deposition of smooth muscles, due to the die of T lymphocytes and monocyte, due to the deposition of lipid and cholesterol here. Suppose that if this fibrous cap of plaque is thick, if this cap is thick, so what will happen, the blood which was earlier flowing through a smooth pathway, it will face a resistance here. Okay, it will face a resistance here due to the fibrous cap which is very thick cap. So the blood flow will get less to our myocardial cells of our heart and they will die. There will ischemia formation. Okay, there will die of cells, there will die of there is necrosis of myocardial cell. Ischemia, we can say there will increase chance of heart attack, there will angina happens, chest pain. Okay, so if the cap is thick then the blood will face a resistance, and if suppose the cap is very thin, this plaque is very thin, then it will rupture, and this cap if once rupture it will leads a bleeding. Okay, due to the breakage of this plaque there is a bleeding formation. So now there is bleeding started. So what will happen, formation of thrombus take place, there is a formation of blood clot. Okay, so this blood clot is at one place. If the blood clot remains in one place, we call it as a thrombus. Okay, and it could be a more dangerous condition. If this blood will travel through bloodstream, then it can reach to other organs of our body, for example in our brain, and cause a more dangerous condition as a stroke. So there is a formation of thrombus, blood clot. So what will happen, more platelets will come there to dissolve the clot, then there is more deposition of fats, cholesterol, other debris, everything will get accumulated here. Okay, and it will completely block the coronary artery. Okay, it will block in a circular motion, it will completely block the coronary artery, and there is a complete blockage of the blood supply, and this is called as coronary artery or heart attack, which can be a minor heart attack if it damages to a lesser part of a cell, and it could be a severe heart attack if it damages the larger part of our cell. So please stay tuned for the next part of this video. Thank you.